Hello, my name is A.Stewart, and today we'll be discussing pediatric cerebral palsy patients in the southeastern United States. For context, I currently work as an EMT intermediate and work as a critical care transport medic for a private ambulance company and frequently interact with patients who have cerebral palsy. It's a very complex disease, and these patients often require specialized care throughout their lifetime. So, what is cerebral palsy? It is a group of motor and balance disorders that affect up to 3 per 1,000 live births in the southeastern United States. It is the most common motor-related disability in the United States. There are 3 major types of cerebral palsy, including spasticity, dyskinesia, and ataxia. Regardless of the type of disease, it is considered non-progressive and tends not to change in severity over time. Currently, there is no cure, so treatment plans tend to focus on treating symptoms. Since it covers a wide range of severity, it is often considered poorly defined in the medical community, although in order to get a diagnosis, it does require that the disability be caused by a lesion or scarring of the brain, most often in the primary motor cortex. It can be either congenital or acquired, and the size and number of lesions will determine the severity of the disease and which muscle groups are affected. Weakness in muscles that support joints, such as the spine, shoulder, and hips, often cause poor joint alignment, leading to decreased range of motion, decreased ambulation, and oftentimes causes deformities such as scoliosis. In severe cases, patients with a weakened diaphragm, the muscle used for breathing, will often require frequent or permanent respiratory support via non-invasive positive pressure ventilation, such as CPAP or BiPAP, or via invasive positive pressure ventilation, such as a tracheostomy with a ventilator. Other phenotypical abnormalities include contractures of limbs, impaired coordination, hemiplegia, and tremors. These patients are also unfortunately affected by a wide range of comorbidities, since the lesions often affect multiple regions of the brain. The location of the lesion will determine the comorbidity, but this is also a fairly poorly understood topic and still requires further research. The most common comorbidity is epilepsy, which affects around 42% of cerebral palsy patients. These patients commonly have a learning disorder and have a higher rate of autism as compared to those without cerebral palsy. Patients are also noted to have upper and lower respiratory issues throughout life, which leads to a greater rate of respiratory illness, which is also the leading cause of death for this population. Currently, there is no direct causal link as to what causes cerebral palsy, and no direct way for parents to decrease risk. While the effects of brain lesions are poorly understood, their formations are pretty well known and are known to be caused by different factors and disease processes. So, pre/postnatal prevention often includes preventative measures to reduce known risk factors. It was previously thought that it was caused by an anoxic brain injury during birth, but recent studies have disproven this hypothesis. Current risk factors for congenital cerebral palsy include preterm birth, low birth weight, multiple births in a single pregnancy, and prenatal complications such as infection and injury. Pregnant persons should consult with their physician, but are encouraged to have updated vaccines, prenatal vitamins, and regular follow-up visits. Lesions that form after birth cause acquired cerebral palsy. Most common causes for this include traumatic brain injury and infections such as meningitis. While a variety of populations are affected by cerebral palsy, several are noted to have higher incident rates. This is especially true among males, who have a much higher rate than females. This is thought to be most likely caused by a lack of neuron-protecting genes in the Y chromosome, but further research is still required. Black Americans are noted to have a significantly higher rate than white Americans, but regardless of race, patients in lower socioeconomic status have higher incident rates and higher severity rates than those in higher socioeconomic statuses. This data is collected through the Autism and Development Disorders Monitoring Program, which is a CDC program, but it is not federally required to be followed. And not all southeastern states participate in the program. States that do include Missouri, Tennessee, Maryland, and Georgia. And in fact, the program is based off of original program started in Atlanta, Georgia. One of the main issues surrounding cerebral palsy patients is their incredibly high medical care costs. It's often 10 times higher than children without cerebral palsy. And if the patient has cerebral palsy and an intellectual disability, this often goes up to 30 times higher, with a lifetime estimated cost of nearly $1.5 million. It's been estimated the combined direct and indirect costs of all cerebral palsy patients born in 2000 will be around $11 billion. These overall higher costs are directly related to their high rates of comorbidities, frequent access to medical care, and frequent hospitalization. Respiratory illnesses are the most common cause of hospitalization and the leading cause of death of all cerebral palsy patients. This is especially true to patients who are ventilator dependent and have an increased risk of pneumonia and other respiratory diseases. While many of these patients are able to stay at home and be treated by family due to advancements in medical technology, they are still incredibly fragile and prone to severe illness. Parents who care for these children often feel undertrained and overwhelmed for even minor complications, leading to an increased hospital utilization. In Missouri, to prevent this overutilization, they created the Missouri Comprehensive Transition Model, and it was created as a means to both empower and train caregivers and to decrease overall costs. The model aimed at addressing the needs of patients at home and providing families with the necessary resources to provide this home care. Training included medication administration, handling special equipment such as ventilators and drug/feeding pumps, and how to treat minor conditions. The program also took a more holistic approach to address the psychological needs of caregivers with therapy, providing caregivers with patient-appropriate leisure activities, and with time management skills. This was a very successful program and led to an incredible reduction in costs, hospital readmission rates, and number of inpatient days in an inpatient setting. Although the program was a success, it hasn't been widely adopted in the southeastern United States. Other researchers have also suggested that a standard best practices protocol be implemented nationally in order to decrease respiratory illness rates. So, thank you for watching my presentation. I hope you enjoyed the content. If you have any questions, feel free to contact me via email. Thank you and have a good rest of your day.